Hello, my name is Nicole Eddy. I am a graduate student at the University of Maryland, and I am here to teach you about pre-hospital tourniquet use. The target audience for this lecture includes EMTs, pre-hospital providers, police officers, military, and bystanders. Life-threatening bleeding can happen at any time, and no matter how rapid the arrival of professional emergency responders, bystanders will always be the first on the scene. A person can die from blood loss in less than 5 minutes, so it's important to stop the bleeding quickly. The objectives at the end of this presentation, the learner will be able to identify signs of life-threatening bleeding, learn the proper use of a tourniquet, and demonstrate the appropriate application of a tourniquet to extremities. Why is a tourniquet necessary? Tourniquets are used for life-threatening hemorrhage from limbs that cannot be controlled by direct pressure or simple methods. Tourniquets can also be used for limbs with multiple uncompressible bleeding sites, and recent studies consistently associate the use of tourniquets with an increased chance of survival. Pre-hospital use is strongly associated with life-saving. First step, how to identify life-threatening bleeding. There will be some certain indicators that bleeding is or will soon be life-threatening. First step, you need to find the source of the bleeding. Open or remove all the clothing over the wound so you can clearly see it. Remove all objects so that the injuries are able to be seen and no longer hidden or covered. Look for life-threatening bleeding. Look for pulsatile. Look for steady bleeding from the injury site. Look for saturated clothes or bandages. Look for any traumatic amputations, and be aware if the patient shows any signs of shock, such as unconsciousness, being confused, or pale. I have a short video about tourniquet use. Proper use of a tourniquet. I'm going to take this model and show you how to properly apply a tourniquet. First, it's Velcroed on itself, so you're going to have to unvelcro it to fully expand it. Unvelcro it again so you can adjust it, and you need to wrap the tourniquet around the bleeding limb. Make sure you put the tourniquet about 2 to 3 inches above the injury site. Don't place it right on top of the injury. Pull the free end of the tourniquet and make it as tight as possible. The band should be tight enough to fit 3 fingers. If you can fit more than 3 fingers, that's not tight enough. Secure the strap around the end of the Next, you take the windlass, this plastic piece right here, and you twist it until bleeding stops. If bleeding is not controlled or distal pulses are present, you can use another tourniquet just above the first tourniquet that you apply. Next, secure the windlass in the plastic piece to keep it tight. You'll have to snap the rod into the clip and then secure it with the overlying strap. This gray one right on top. And then as you can see, it says time. You want to make sure you indicate the time that you apply the tourniquet. That's going to be very important to the ER physicians and the trauma surgeons that take care of this patient. Now we're going to take a moment to have a demonstration and practice. Some tourniquet mistakes. Some mistakes that could happen would be not making it tight enough. Some people are scared that if they make it too tight, it's going to hurt the patient. I hate to tell you this, but pain is good. It is going to hurt. I'm sorry, but you could possibly save their life. Another mistake that people have is that they wait too long before applying a tourniquet. They see a spurting injury, they're not sure if they should apply one or not. The patient's already shows clinical signs of shock before they actually put the tourniquet on. I have another video here for you. Okay, now that we reviewed that, I have a case study. While on duty, a police officer responds to a report of a drug deal. The police officer questions the suspect on his actions and the subject becomes aggressive. The situation quickly turns into an altercation with the suspect pulling out a gun from his waistband and shooting the police officer in the right leg above the knee. The police officer notices a steady stream of blood pouring out of the wound and that his uniform quickly becomes saturated in blood. The police officer retrieves his newly issued tourniquet but is not sure how to use it. He places the tourniquet around the right leg 2 inches above the wound. He tightens the windlass and secures the device. He notices that the bleeding has slowed but has not stopped. He is feeling significant pain since placement of the tourniquet, and he thinks that he must have applied it wrong. But at this time, the ground above the police officer is saturated in blood, and just then emergency crews arrive. So do you think the tourniquet was applied correctly? How do you know? What should he have done in this circumstance? We'll have a moment for discussion. Does anybody have any questions?